Welcome back, everyone, on this Thursday. In today's Better Health, we're talking interventional radiology. It's a way to treat and diagnose diseases using what's known as minimally invasive care, which we like.
The procedures differ from basic radiology without the need for surgery. Here to demonstrate and explain those methods is medical doctor Kahn, president of the New England Endovascular Center. Welcome.
Well, thank you for having me. Really appreciate it.
Thanks for bringing all the
our
items,
toys.
all
Yes.
the toys to explain. So first, what is interventional radiology?
So interventional radiology is a field based on minimally invasive techniques. It's based on radiology, which is imaging, live x-ray called fluoroscopy, ultrasound, CT. We use the imaging that when people think of, I'm going to have a CAT scan or I'm going to have an x-ray, we employ that technology to do procedures in the patient in a minimally invasive way because we can see inside the patient without having to make a large incision.
And hence minimally invasive. So instead of going underneath a complicated surgery procedure, you're able to kind of skip that surgery part, right?
Absolutely.
And that helps in many ways, but also with recovery, I would think.
Right.
Less invasive, less recovery time.
Absolutely. In fact, our field really, if you look at interventional radiology procedures, there's probably more than 100 things we do, but they're all, all of them are minimally invasive, and most of them are outpatient, probably more than 95%. Wow. And that's why we've been able to open Western New England's first truly outpatient center, where our patients come in the morning and they're out in the afternoon. So
that's awesome.
What's one of the procedures that people might be surprised that you can actually use some of these items and it is minimally invasive?
Absolutely. So one of our specialties is limb rescue. So patients that build up plaque in their arteries, diabetes, smoking, hypertension, they develop blockages in their legs. And we have a number of tools. For example, I brought here just for you to see, but this is an example of a stent. And you can see it's a bare metal scaffolding. We also have covered stents that are used to shunt blood flow. So this is how an aneurysm might be fixed.
That actually go in the artery?
So big.
Absolutely. But if you see here,
I know, right?
We brought, if you can hold the other end of this,
sure.
And I'll show you here. A stent deployment, you just simply pull back here. You see the stent deploying in front of your eyes.
Wow.
And you can see the stent deploying.
Oh, there it goes.
And you
it's kind of like that pop-up toy we have.
Really?
Probably a little more expensive.
Yeah.
Yes. But as you can see, this is the size of the actual device. So you can repair a blocked artery simply by deploying a stent like that.
Wow.
You hear about angioplasty balloons, which are sometimes used in the heart. This is just simply an inflation device, but you can see a balloon here, and it's really quite firm. It exerts a lot of concentrated pressure, and you similarly can just inflate. The balloon's now deflating, but you can see how we can introduce very small tools. The technology has expanded to one of our major things that we do is women's health. So uterine fibroids, you probably know someone with uterine fibroids. They're abundantly common, and we offer a procedure called uterine fibroid embolization where we intentionally cut off the blood flow to starve the fibroids of their blood flow and shrink them. Right. And for many patients, this is a curative treatment and avoids the need for hysterectomy or a myomectomy, open surgery. And that can be simply accomplished through, this is a standard hockey stick catheter. You can see why they call that. But this is literally all we have to do is make a pinpoint incision to introduce this into the bloodstream. We use a live x-ray machine to steer to where the vessel supplying the fibroids are. And then we inject these tiny little beads. They're probably not going to show up well on camera, but they're less than 1 millimeter in size, and they just simply plug up the vessels and obviate the need for surgery. All done outpatient.
This is like Star Trek technology. I'm absolutely amazed.
It's funky to see it in person and how it's done.
And you explained it very well. I've often wondered how they're able to, or you're able to perform these operations so minimally invasive. It's because these tubes are pretty much the only thing that's doing the invading.
Tiny. Absolutely. I mean, the most invasive thing we do in our office are ports for chemotherapy, which again is probably about an inch, not even an inch, probably 3/4 of an inch incision. It's very, very small. So minimal suturing, minimal invasiveness, everything's done outpatient.
Maximum recovery.
Absolutely.
Wow. Dr. Kahn, thank you. We appreciate it.
I appreciate you having me.
Great lesson.
Yeah, really. When we come back,